No worries. Okay, so it's recording now, just so everyone knows. And this first one today is kind of our introduction module of the 12. So it is to do a lot with falls and just kind of the stats around them, what causes them, how do we help prevent them. And you'll notice a lot of things that we do in our programs is something that can help with falls prevention. So I'm just going to do the share screen now and pull up my PowerPoint. Can everyone see that?
Mm-hmm. There's nothing there yet.
Oh, no.
Here we go.
There it is.
Oh, there we go. Perfect. All right, so this is the first topic, and it's called Staying on Your Feet. Again, we used to call it Falls Basics, but a lot of our participants didn't really like that everything was called falls because they may not have been experiencing falls yet. So little disclaimer, we tell this to everyone at the start of the classes, is that the information contained in here is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or qualified health provider with any questions you may have. All right, so the goal of this specific class, this first one here, is to be more aware of the cause as well as the impact of falls, and to increase the awareness of the benefits of physical activity. So the first part, we talk a lot about what might lead to a fall, what can we do to help prevent a fall, as well as at the end, then we cover kind of the benefits of physical activity because we know that's one of the major ways that we can help prevent a fall. And I always start with this general knowledge quiz with the participants. The first time we go through it, we don't give the answers. It's more to kind of start that discussion and kind of introduce all the different things that we're going to talk about today, as well as over the series. And then we'll go through it again at the end of the talk and just see if any of our answers changed. And that's when I will give the actual answers. So feel free to shout your answer out when we go through it, and if you don't want to, that's fine too. So the first question is, every year 20 to 30% of older adults will fall at least once. What do we think?
True.
True.
True, I'm hearing trues. All right. Number 2, most falls result in serious injuries. Yeah. True or false?
False.
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 I'm going to say false.
False. Good. Often when we do this with participants, there are some people who say true and some who say false. So we do talk more about this one as we go on. So number 3, almost half of all falls occur in the home.
True.
True.
Number 4, after a fall, you should acknowledge that you are afraid and reduce your activities.
False.
False. False.
Good. Number 5, safe equipment is often expensive, difficult to find, and not very attractive.
False.
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 And this one's talking more about like canes and walkers and grab bars and different things like that. All right, number 6, as we get older, we should enhance the lighting in every room in our home.
True.
Number 7, we have the right to adapt our home to make it safer, even if we're just renting or tenant.
True.
True.
Number 8, we should get our vision checked every year.
True.
True.
Number 9, you should exercise at least 3 times per week.
True.
True.
I like your answer so far. And then the last one, some medications can increase our risk of falling.
True.
True.
All right, so that's the quiz. We will go through it again at the end, and I will give the answers, and we can talk a little bit more about it then. Does anyone have any questions before we jump right in? No? All right, so the first thing we'll go over is a definition. We're going to talk about the difference between a fall and a near fall. So a lot of people describe them kind of the same way when I ask at a class, what is a fall? And then there's kind of a distinguishing factor between the two. Do any of you know what makes something a fall and not just a near fall? So they can start off the same way. And what a fall is any sudden, uncontrolled, or unintentional event that causes a person to be on the floor or some lower surface without their feet bearing their weight. So usually when I ask this at a class, the answers that I get are things like lose your balance, trip, slip, end up on the floor. And oftentimes, those are all kind of correct ways how a fall might happen. But the important thing to remember with a fall is that part there about without the feet bearing the weight. So you can have a slip or a trip, or you can lose your balance, but that doesn't mean that it's a fall, right? So it's more so when you've lost control and you end up on some sort of lower surface where your feet have gone underneath you. So you could fall to the floor, you could fall to a couch, you could fall onto the bed, you could fall onto a chair, fall onto a toilet, tub, different things like that. But the big thing here is that your feet are no longer supporting you. Does that make sense?
Yep.
Yeah?
Yep.
All right, so then a near fall, we've kind of already covered it, but it's any kind of event where a person has had a sudden loss of balance, but the difference is they have been able to regain their control. So this could be just simply with changing of their posture, where they've maybe thrown their arms out and they've been able to steady themselves. Or it could be maybe they had to grab onto a chair, or maybe they had to touch onto the wall. In some way, they have regained that control and their feet have remained underneath them. Make sense? All right. And then at the bottom of the screen, it says, are you at risk for falling? So one of the first things that might be a sign that someone is experiencing falls or at risk for falling is if they have had a fall or even a near fall in the past year. So that's why on a lot of our stats, we used to ask that question. And then if the answer was yes, we'd automatically refer them to the Integrated Regional Falls Program. Because if they have had a near fall or a fall in the past year, it might be a sign that something's going on, that they might be at a greater risk of having a fall. And these are some of the causes of falls and some of the risk factors. So there's a lot of things that could lead into someone experiencing a fall, and there could be one of them contributing, or there could be multiple, right? So this is a big list here of some of the common causes of falls and some of the risk factors. So one of the first ones is leg weakness. And sometimes that surprises participants when we talk about that in the class. But if you think about it, if the whole reason why something is deemed a fall is if our feet have gone out from underneath us and we are no longer steady on our feet, then leg weakness can have a big part of that. If our legs are stronger, perhaps maybe we'll have more near falls than falls. So a lot of our exercises kind of target strengthening the legs in order to help decrease that risk of having a fall. The next one underneath it is balance or walking problems. because typically when people do experience a fall, the first thing they say is, oh, I lost my balance, right? So just being aware of that if they are experiencing altered balance or changes to their mobility, then that could mean that they might be at a greater risk of having a fall. Vision changes are next on the list. And we actually cover this in more detail in the next unit when we talk about taking charge of your health. We do talk a lot about vision and the importance of getting our eyes checked. And just like in the true and false quiz, getting them checked every year is really important, because a lot of us know how important vision is for us just to navigate our environment, to walk around safely and avoid trip hazards and different things. But sometimes we forget how important our eyes are for balance, right? When I used to lead the pilot project of Enhance Smart, we used to have to test everyone pre and post on their balance. And one of the tests was having them stand and close their eyes. And sometimes we take for granted how easy that can be when we are kind of not experiencing any kind of changes. But for many of those clients, automatically they either fell into the chair or we had to stop the test because it was just too difficult for them. Our brain does rely on our vision so much in order to know where we are in space, know that we are safe, and just kind of deal with our balance in that way. So vision is really important. The next one is acute or chronic illnesses, because we know that there are a lot of chronic conditions that can impact either the way that we move or impact kind of our cognition or impact our strength and different things, impact our reaction times, or perhaps they mean that we need to take certain medications that may do one of these things. So someone who's experiencing an acute or chronic illness, depending on the type, that could put them at a greater risk for having a fall. If we think about something even as simple as the flu or a cold, and often we do feel weaker during those times, even if it isn't necessarily attacking our muscles or anything like that. So that could put us at a greater risk of having a fall. Or if we're on kind of medications that makes us drowsy, then that could impact our risk of having a fall as well. The next one is decreased sensation. So that's when someone experiences kind of loss of feeling. And most commonly for falls, it would be kind of the legs and the feet. Because again, our brain relies on feedback from our skin and our joints and our muscles and that feeling in order to know that we are steady and safe and balanced, in order to kind of deal with any kind of changes to that. So if there is altered sensation, then that can put us at a greater risk of having a fall. That one's especially important if someone is either living with, say, diabetes or a stroke, different things like that. The next one is syncope or fainting. So syncope is fainting, essentially. And sometimes that's what causes a person to have a fall. Those ones are harder to prevent because sometimes people experience that without even having any kind of warning signs. And it's also kind of linked to the dizziness and postural hypotension that's in the next column. So postural hypotension is that drop in blood pressure if we get up too quickly. So sometimes this might be more common for someone if they either rise from a chair too fast or they try to jump out of bed if they have to have an urgency to go to the washroom or something in the middle of the night. So it's always an important one to be aware of. And we do talk about later on kind of the ways to slow down that change in posture and take our time before we start moving. Also on there is hearing loss. And there's a lot of research going into that as well about how hearing loss can impact our risk of having a fall. We talk about this more in the next module as well, along with the vision. But there's a few reasons for it. when we talk about the brain and what it relies on for balance, so we talked about the vision and we talked about kind of the sensation and the different receptors in our body. But the third system that it relies on is actually the organ inside our inner ear. And it's an organ filled with fluid that when your body moves a certain way, like forward and back and side to side, that fluid moves and it stimulates to your brain which way you're moving. So if for some reason it starts to sense that you're moving this way, your body's going to react and try and keep yourself upright. So if there's any changes to that, someone might experience a greater risk of having a fall. But aside from that, just hearing loss alone has actually been linked to an increased risk of fall as well. One of the reasons is that they're finding that when people are experiencing that hearing loss, they're using more of their brain power to try and hear more, especially if it's hearing loss and not deaf altogether. So they're straining more to try and hear. They're dedicating more brain power to that. So then when they are in the middle of a task, like say walking, which also requires some brain power, then there's only so much brain power to go around. So if they're dedicating so much to it, to the hearing, then there's more risk of something happening if, say, they did slide a little bit on a small pebble. They may not be able to react as quickly because so much of their brain power is going to trying to hear. Another thing is that, especially if the hearing loss is more on one side, sometimes a person will actually turn their head so that the good ear is facing center, so that the way that they hear, it's all coming into center, like as if they have equal hearing on both sides. And by turning your head, that can actually alter that inner ear, alter your balance, alter what you're looking at, so navigating around your environment, and it can actually lead to increased risk of falling as well. Any questions so far? No? Good. All right. Next one is foot problems and improper footwear, and we do have a whole topic dedicated to that. It's number 6 in the series, so I won't spend too much time on that now, but there are a lot of improper footwear that can put us at a greater risk of having a fall. And the big thing with this one is if our feet hurt, we don't want to use them, so we're not going to be as active as we once were. And then that leads us into this fall cycle of losing strength and mobility, which puts us at a greater risk of having a fall. And then the cycle just continues. So it's really important to stop that cycle. And footwear can be a component of that. The next one is cognitive changes, and whether this leads to more risk-taking type behavior, or how it impacts the way that we move and different things like that. Depression has been linked with an increased risk of having a fall. Functional or activity of daily living decline has also been linked with a greater risk of having a fall. The next two in the third column are home environment or a risky environment. So that could be indoor or outdoor. And if people are concerned about their home environment, I always talk about how you could go to your doctor and get a referral for an occupational therapist to do a home safety assessment. Outdoor hazards, medications. So we also have a whole topic on medications as well. We don't so much talk about specific medications. It's more so about safe use and the side effects that we should be aware of. History of falls, so I mentioned that before. If someone is experiencing a fall or has had a near fall in the past year, they may be at a greater risk of having a fall, because again, something might be going on that's causing that. So it's really important to get our falls evaluated if we are experiencing them. And then a fear of falling. So that is that cycle as well that I was talking about before with the footwear. So sometimes if someone has a fear of falling, they restrict certain activities for fear of falling. And then that actually puts them at a greater risk of having a fall because, again, if you're avoiding activities, you're going to lose that muscle strength, lose that muscle mobility, joint mobility, and actually be at a greater risk of having a fall. So that's also why exercise and kind of being aware of all these different factors is really important to help kind of mitigate that fear of falling. There's no one thing in the research that has been proven to decrease it because it depends on why that person is fearful, right? Any questions on any of those?
Nope, I'm good.
We're good. All right. Next are just kind of, I call this part the bad news. And it's kind of the facts about falls, some of the stats that might kind of scare people a little bit about falls. So the first one is 85% of injury-related hospital admissions of seniors in Canada are related to falls. So most of the time, when an older adult is admitted to hospital with an injury, it is because of a fall. Now, it doesn't mean that all falls lead to this, but it is kind of the common reason why people are admitted to hospital with an injury. We know that we can fall at any age, and we do, but we tend to see the fall rates increase over the years. So we may see more falls as we get older. But the thing to remember is that falls are not a quote-unquote normal part of aging. There are reasons behind them. So we shouldn't expect to fall simply because we're a certain age. 20 to 30% of older adults will fall at least once in the year, and that was in our true and false quiz. And then 1 in 10 falls will result in serious injuries. So this isn't most falls, this is 1 in 10. And when we talk about a serious injury, it's something like a severe blow to the head where someone has kind of like a hematoma type injury, or if they've broken a hip or broken certain bones. These would be serious injuries. If someone ended up with just a bruise or something like that, that wouldn't be a serious injury. All right, so more about the stats. So this part always gets a lot of discussion. Most recently when I did this talk, it was on teleconference with a few ladies. And so this first stat is about half of all falls lead to a hospitalization happen in the home. So it's about half of all falls occur in the home, while the ladies on the call, their falls were outside of the home. So they can still happen anywhere, but about half of all falls that lead to a hospitalization happen at home. Does anyone know where in the home might be particularly kind of hazardous? Or
Bathroom.
Bathroom?
Bathroom, yeah.
Where in the bathroom?
Bathtub. Bathtub.
Bathtub. So, and that's what I get every single time when I ask the question with all of our participants and clients as well. So yes, the bathroom and the stairs can be quite hazardous. And the number one place, if we're looking at the number of falls in the bathroom, is actually the toilet. However, most falls that lead to an emergency room visit are in the tub or shower. Because we know that that's kind of a risky area. We know that there's water, there's slippery surfaces, there's soap. It requires a lot of balance to step in and out of the tub. If someone doesn't have a bath seat and they're standing in there, that requires a lot of endurance and balance as well. But there are also some risks with the toilet, and we tend to know the risks with the tub or shower more, so perhaps we're a little more cautious with those. Also, if we think about it, how often in a day do we typically access that tub or shower?
Once.
Maybe once, right? What about the toilet? Hopefully more than once, right? Hopefully more than once. And with the toilet, sometimes we don't always think about the risks there. And sometimes there's a sense of urgency, or there might be rushing, or it could be in the middle of the night when it may not have as good of lighting, right? What might be the factor with a toilet that kind of leads to a fall?
That it's too low.
Having to kind of back up into it.
Yeah. So turning around to back up to the toilet, sitting down, or even just standing up from that toilet, especially if, like Rita said, it is too low, because that's where our leg strength comes into play, right? It requires a lot of leg strength to sit down to the toilet and to stand up from it again as well. So if people don't have the safety measures in place and they are experiencing that leg weakness, this can be particularly hazardous for them. So that's why it is really important to be aware of that. And if someone is experiencing falls, then maybe look into some of the assistive devices for the bathroom, like grab bars or toilet frames or raised toilet seat or raised toilet in general, because a lot of falls do happen here. So we want to kind of minimize that for sure. Any questions on that? No? Perfect. All right, so some more kind of bad news. In the media, they always talk about falls and how expensive they are for the healthcare system and different things like that, which they are. They're very expensive. In one of the stats, I'm just going to try and find it here. So just with Ontario, there's $1 billion spent each year on direct healthcare costs related to falls. And then for Canada, it's $2 billion each year. So it is expensive for our healthcare system, and even for the person experiencing the falls, because it may mean that they have to put some of these safety measures in place. But the thing we focus on more in the education is that personal cost of the fall. So not so much about the financial, but how it could impact our day-to-day lives. So some of the big things that the participants have mentioned in past are things like pain and suffering, loss of mobility, even if it's just temporary, or it could be permanent, loss of independence because of that, a change in living arrangement, increased fear of falling, which can be quite debilitating depending on how advanced it gets and how much it impacts someone's life, and decreased quality of life if all of these kind of factors are going into it as well. So we want to make sure that people aren't experiencing this, or we're trying to manage it so that they don't have to be experiencing all these personal costs of the fall. Some more of that bad news is that adults age 65 and older are more than 3 times likely to be hospitalized for a fall-related injury. So even though we all fall throughout the years, once we get over the age of 65, we're more likely to be hospitalized from that fall. But again, remember that only 1 in 10 have those serious injuries. 95% of hip fractures among seniors are due to a fall. And this sometimes leads to most people's fear of falling, is that fear of breaking a hip. And that 95% is quite high. But the thing to remember with that is that if someone is falling from something like standing height or walking and they have a fall and they break their hip, that wouldn't happen with normal healthy bones, no matter what age you are. If they're experiencing that from something minor, like a fall from standing height, then it is a sign that they might be living with osteoporosis, which is the condition that impacts their bone health. So that's something to be aware of as well. The scary side of that is that osteoporosis is kind of a silent thief. Often we don't know that we have it until we have broken something. But in general, we should not be breaking our hip from falling from standing height. That is considered a fragility fracture. And then the other bad news that no one really likes to hear is that more than 1/3 of long-term care admissions are falls related. Now, that doesn't mean that simply someone is experiencing falls and they have to be admitted to long-term care. Usually that is more related to they've had a fall, they broke their hip or something, and they are no longer able to do many of their day-to-day activities, which means they need more help and support, which means they need to go into long-term care. I know with the SMART program, when I started with that, and we always had to ask the questions about, do you experience falls or have you had a fall? They're always like, no, 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 no. And I have a feeling that it was that perhaps they didn't want to be seen as that they couldn't live on their own anymore, that these falls meant that they couldn't be as independent as they are. It's just, and with long-term care admissions, it is more to do with the injuries that come from them. Any questions on that? No? Alrighty, good. So after a fall, this is something really important to go over with all the participants and clients that we do see, is that number one, any fall actually does need a medical evaluation, because again, we need to figure out what might be causing it to help reduce our risk of it happening again. So this could be something as simple as just letting your doctor know, so that you can kind of investigate to see if, is it related to a medication? Is it related to weakness? Is it related to the home environment? Is it related to just taking a risk? Just kind of being aware of what might have caused it so that we can help prevent future ones. And then number two, if there is an injury, we should get medical assistance for that injury right away, and then notify primary care. So again, we should let the doctor know that we experienced a fall and that there was an injury. The big one here that not a lot of people may know about is number three. So if there is a blow to the head, any kind of loss of consciousness or signs of confusion, we need to seek immediate medical attention. So when I was on that pilot project and we'd ask that question about have they had a fall, sometimes the person's care partner would say, oh yeah, I found her up in the bedroom yesterday. I think she had a fall, but she was a little confused after, but she was fine. But it was really important to let them know that, well, she was confused after. Perhaps that means that she might have hit her head, right? And we know now a lot with the research to do with concussions, as well as kind of the risk of injury to the brain. If someone's on a medication like a blood thinner or different things, it's really important to seek immediate medical attention if there's anything to do with the head. And usually I tell participants, this is why if you do fall, one of the first questions people will ask you is, did you hit your head, right? Because it is really important. I know when Balance of Care started, one of the kinesiologists was coming with me to do this talk, and she actually shared that 3 people she knew in that week had hit their heads and didn't notify the doctor, and one person ended up having like some sort of just general bleed. One person had a stroke after it, and the other person had something else. So it is really important to get medical attention right away. Make sense? Good. All right, so the next part, we've talked about it a little bit as we've gone along, but this is the fall cycle. And usually if you look at the top of the cycle there, it has fear of falling. So we usually talk about this with fear of falling and how dangerous that can be, because most often when someone is afraid of falling, perhaps they avoid certain activities, so that decreased activity, which can actually lead to that loss of strength and mobility, which then puts them at a greater risk of falling. If they're at a greater risk, maybe they feel less stable, less confident, so they're more fearful of falling. and the cycle just continues. So it's really important that we don't decrease our activity, right? We want to keep being active, keep doing as much as is safe to do so of our day-to-day activities in order to keep that strength and mobility up. So with that being said, if there's a particularly risky activity they were doing before, perhaps, yes, maybe they want to avoid that. But in general, we don't want to decrease our activities. We want to stay as active as we can, to stay as strong and mobile as we can, to help reduce that risk of having a fall. And hopefully, if we are staying active, and that means that we will feel more confident and secure and stable when we are moving around, and hopefully that means that the fear of falling will be a little bit less. Again, there's a lot of research going into fear of falling and how we can help minimize it. And the big thing with it is that not one thing has resulted in a significant decrease in fear of falling. So there's a lot of research into exercise. Does exercise alone decrease it? And in most cases it doesn't, because usually there are other factors leading into that fear or that risk of falling as well. So it's really important to tackle it more than one way. So that's all the bad news. But the good news is that most falls are the result of modifiable risk factors. So usually there is a reason why we might be experiencing falls, and there is something that we can do about it. Again, it's important to remember that falls are not a quote-unquote normal part of aging. I hate the word normal, but it just basically means that we should not expect to be falling simply because we are older, or that's the reason behind it. Oh, I fell yesterday because I'm a certain age, right? There usually is a reason for it. So what are some of the ways that we can reduce our risk? Usually I ask everyone for what they do to help reduce their risk, but there's a little bit of a chart here on the slide. So ensuring adequate lighting in the home is one really important one, especially if they do have to take nighttime trips to the bathroom. Ensuring that there is adequate lighting to do that is really important. Adapting our home to make it safer. So there could be risks in our home that we aren't even aware of, or there could be ways to do it that is safer or easier that we haven't even thought of yet. So sometimes that's when an occupational therapist might be really helpful in someone's journey to decrease their risk of having a fall. Using assistive devices. And this is a big one for, I know, quite a few people that we've worked with over the years. Sometimes they have all the devices they may need, like walkers or canes or different things, but they just don't want to use them. So it's really important that if they do need it and they have been fitted for it, that they do use it and use it properly. So sometimes there's a lot of education that needs to go around that as well. Donna Henderson, who used to work with the Integrated Regional Falls Program, now part of Specialized Geriatric Services, she was really good at kind of changing people's mindset around that. And because often they would say, oh, I don't want to use it because I don't want to look old. But she would just kind of say, well, how do you think you're perceived when you're using a device and you're standing up nice and tall, nice and straight, and you look independent and you're in a good posture, versus if you're trying to move around without that device and you're kind of wobbly, hunched over perhaps, and touching onto furniture and different things. Oftentimes that would kind of get them to kind of reframe their thinking around it as well. Yearly vision checks are really important. Again, we'll talk about that more next time. And CNIB actually reports that about 75% of vision loss can be prevented. So a big way to do that is those yearly vision checks. Medication reviews are really important because often, especially with older adults kind of one of the biggest risk factors for them is the different medications they may be on. And there are a lot of medications with side effects that can increase our risk of having a fall. So it is really important to get your medication list reviewed every year, either by your doctor or pharmacist, because sometimes dosages may need to be changed as we get older because our body breaks down medication slower. Or there may be certain medications that we're only meant to be on for a short period of time. Or if a condition progresses, maybe the dosage needs to change. So it is really important to have that yearly review. And then the next one is exercising at least 3 times per week. It's really important because of all the benefits of physical activity for falls prevention. And if we look at these next slides, so it is all about physical activity and what we know and how beneficial it is. So it says that being active reduces the risk of heart disease, obesity, high blood pressure, type 2 diabetes, osteoporosis, stroke, certain cancers, depression, falls and injuries, and premature death. And a lot of these conditions actually have symptoms that could put us at a greater risk of having a fall as well. So it's kind of multimodal in how it impacts everything in that way. And then just that little picture on the side, it says that if exercise was a pill, we'd all be taking it. Because a lot of people do go to the doctor and they want a miracle solution for this and for that. And most often, physical activity and exercise is really beneficial. So if it were a pill, everyone would be taking it. And then some of the other benefits of physical activity. So there are benefits of starting something new. You could meet new people, feel more relaxed, sleep better, have more fun. And then there's also benefits of being active for a regular basis, ongoing. So continued independent living, better physical and mental health, improved quality of life, more energy, fewer aches and pains, better posture and balance, improved self-esteem, weight maintenance, stronger muscles and bones, relaxation and reduced stress. The list goes on and on. And we do have a talk that's dedicated all to exercise as well and the different types that we need to incorporate to best reduce our risk of having a fall and maintain our independence and our health. Excellent. Any questions on that? No? All right, so the last thing we have to go through is that general knowledge quiz, and I will give the answers this time, but you had really good answers the first time. So the first one is, every year, 20 to 30% of older adults will fall at least once. What was that answer?
True.
True. It is true. Number 2, most falls result in serious injuries.
Oh,
False.
False. That is false. So we said that it was about 1 in 10, right? Most falls are actually predictable or preventable. Number 3, almost half of all falls occur in the home.
True.
True. And where in the home?
Bathroom.
In bathroom. Where in the bathroom?
The toilet.
Toilet. Yep. Number 4, after a fall, we should acknowledge that we are afraid and reduce our activities.
oh,
False.
False. Because that leads into that fall cycle that we mentioned. Yes, if there's a risky behavior, maybe we want to avoid that, but in general, we don't want to reduce our activities. Number 5, safe equipment is often expensive, difficult to find, and not very attractive.
oh,
False.
oh.
False. So this one is a little bit subjective. It is false. Some safe equipment can be expensive, so things like walkers and wheelchairs and some of those higher ticket items. But usually with those ones, there are certain programs in place to help offset the cost. So things like the assistive device program, for say a walker, they provide 75% of the cost, and then the person only has to pay 25%. So that's really important. Some things you can make, some things you can find in the dollar store or Walmart or different places, right? They're not difficult to find. So again, you can find them in all these different places, but also especially in kind of our region, there are a lot of specialty stores out there like Motion Specialties, Shoppers Home Health Care, Superior Home Health, a whole bunch of different ones that you could go in there and they have a whole host of items that are helpful. But also if you don't see what you need there, there's a catalog that you could probably order anything, things that you couldn't even dream of in there. And then the not very attractive part, that's the subjective side. But as you've probably noticed, a lot of canes and walkers and different things have kind of changed their design over the years, and they are a little more sleek. They come in hot pink and bright green and glow in the dark, and there are a lot of really neat options out there. So subjective, but they're getting better. Number 6, as we get older, we should enhance the lighting in every room in our home.
True.
True. That is true. Number 7, we have the right to adapt our home to make it safer, even if we are just a tenant or renting.
True. True.
That is true. The landlord may put up some red tape around it and say perhaps you have to pay to have it installed and then pay to have it taken down and restored the way it was when you leave. But it is your right. It is everyone's right. Number 8, we should get our vision checked every year.
True.
True. We should. Some people, it's more often than that if the optometrist is looking out for a specific condition. So a lot of people have told me that they go every 6 months. But in general, it is every year. Number 9, we should exercise at least 3 times a week.
True.
We will go over like the physical activity guidelines and some of the more specifics around that. The physical activity guidelines say 150 minutes over the course of the week, which is broken down to about 20 to 30 minutes a day or 5 days a week. But we should be at least 3 times. And then number 10, some medications can increase our risk of falling.
True.
True, very true, right? Many can, and the danger is sometimes they interact with one another. That can make it even worse of an experience, so always being aware of that. And that's everything. Any questions or comments, concerns?
Good job.
Good job.
That's great.
So that is meant to be kind of just a summary of all the topics that we will be going over these 12 sessions. So keep in mind that there are 12 different sessions. This was number 1, and we will cover each one of those little points that we touched on today in more detail. If you have any questions coming into the next one, feel free to shoot me an email or ask me at the start of the next one.
But Andrea, before we hang up, can I just ask, there is a few people that joined by telephone only. Would I be able to get your names just so that I can record you into Andrea's attendance? So there's somebody from a 905 number.
I think that's Mary.
Okay.
I think.
I have somebody from a 705-326 number. Okay.
Sorry, that might be Colleen. I think Colleen